How's it going, everyone? My name is Ben, and I am a trans man and medical student, and I just finished my second year of medical school, but in addition to that, I'll be getting top surgery on June 9th, so exactly like a month from now. So today, because I'm a medical student and I can give adequate medical knowledge, I decided to do a video about the supplements that I'll be taking before my top surgery, my pre-op supplements, and kind of my intra-op during my operation and slightly after my operation supplements that I'll be taking so that I get the best results possible with the least amount of swelling and the least amount of bruising and the fastest recovery time. I think that a lot of trans men have already shared a lot of valuable information online, but because I have a really good medical background, I feel like I can give more details on the things that trans men should be taking when they're going through their top surgery journey. Again, I do want to emphasize that I'm only spreading general medical knowledge, not personal medical advice. Also, before we get started with today's video, I just want to say thank you guys so much for contributing to my top surgery fund on GoFundMe. I know we only reached the halfway point on the GoFundMe, but I had a lot of friends send me direct payments, and a lot of organizations have helped me out with my top surgery, so I'm actually getting it fully covered when I get it done in the next month. So thank you guys so much for watching. I wouldn't have been able to do this without you guys. So as someone who's in the medical field and someone who also grew up in a very underserved environment throughout my entire life, I don't want to give you guys a bunch of medicines and vitamins to take before top surgery. I want to give you a couple of really affordable, easy to get ones that have been clinically proven to aid in wound repair and surgical repair and post-plastic surgery repair, and also highlight why they work, and also show you the benefits and also the cons of these supplements, so you personally can decide, like, is this what I want to be taking when I get my surgery done? However, I am going to encourage you, before you decide to take any of these supplements, please reach out to your medical provider, either your primary care physician or your top surgeon, or your surgeon depending on what kind of surgery you're getting, and ask, hey, can I take this? Is this okay for me to take before my surgery? Because different surgeons, different healthcare providers have different opinions on the supplements that I'll be showing you, because some of them have kind of anecdotal evidence, but it's still widely used in practice. So definitely reach out to your doctor and get the approval for them to start using it, and then go ahead and start using it, because I do not want anybody to irresponsibly be taking supplements from this video. Okay. So I'm going to be going over 5 supplements that I think are beneficial to post-surgery recovery. And let's get started. So the first one is a very simple one. It's actually a daily men's multivitamin. And the reason why is because many Americans, unfortunately, are undernourished, and we don't even know, because we look great, but a lot of Americans have really bad diets that don't consist of whole grains, whole fruits, whole vegetables. I don't even eat fruit that often. So it's very, very important that we have a balanced nutritional profile when we are having surgery, because if there is a deficiency in any vitamin or any mineral in our body, then it'll make it harder for our body to adapt. It'll make it harder for our body to recover and create adequate scar tissue, and create scar tissue that looks more like skin. So that's a huge thing. Scars form, but not all scars look like the skin that we have. Obviously, scars don't look exactly like the skin that we have, but some scars are darker, some scars are more hypertrophic, which means they're raised and they look like a bump instead of like a flat scar. So it's really important for you to get the adequate nutrition that a daily man or transmasculine individual needs in order for them to get good results post-surgery from healing. Just make sure you're getting adequate nutrition. I know some of you guys will have a concern, well, daily vitamins have vitamin E in it, and my surgeon told me that not to take vitamin E. Well, Ask your surgeon, because most surgeons don't really have a problem with the amount of vitamin E in daily multivitamins, because it's the bare minimum that you need for survival. And as long as you're not taking a specific vitamin E supplement, you should be completely fine. But definitely ask your surgeon. Mine said it was completely fine for me to take a daily vitamin, and actually is pretty beneficial for me. So that's the first one that we just covered. The next one I'm going to highlight is vitamin C. Now, vitamin C is incredibly important because it's a cofactor for collagen synthesis. And collagen is what creates scar tissue. It's the initial type of fabric that our body makes in order to stop bleeds. It's the initial component of scars, and then that scar gets replaced by granulation tissue, which is also composed of collagen. So vitamin C is incredibly beneficial to wound recovery. And people with vitamin C deficiency actually develop scurvy. And if you don't know what scurvy is, pirates had it back in the day because they never had vitamin C out in the sea. Haha, get it, CC. But dad joke. Vitamin C, if you don't have enough vitamin C, you will have poor wound healing. Also, vitamin C helps your immune system and help fight free radicals. So when you make an incision on the body, what happens is that a lot of your white blood cells come into that site and start releasing these things called cytokines and these chemicals, right? And when these chemicals are released, it kills the bacteria in the air that are trying to enter your body, but at the same time, these chemicals generate free radicals. And these free radicals are not only harmful to the bacteria, but also your own tissues. So when you take vitamin C, it's a free radical reducer. So you will have much faster recovery time, and those free radicals won't be damaging your own tissues as much. Now, for me personally, I am taking vitamin C for 2 months, 1 month before surgery and 1 month after surgery, and I'm taking 1,000 milligrams. So I have a 500 milligram container of tablets. I'm going to take it twice a day. The next supplement that I'm going to emphasize for everyone to take or consider taking is zinc. Now, zinc is a very important cofactor for a lot of things that help with wound repair, similar to vitamin C. It specifically is a cofactor for something called metallothioneins and metalloproteinases, which help with collagen production. And if you have enough zinc in your body, it's definitely going to help with that synthesis. And also, zinc is antioxidant, very similar to what vitamin C is. I will stress, however, unlike vitamin C, where you can't really overdose from, you can suffer from zinc overdose. So definitely reach out to your doctor and ask him or her or them what milligrams, how many milligrams of zinc you should be taking before surgery, and how many milligrams of zinc you should be taking after surgery, and what kind of zinc, because zinc is often attached to another compound. So this one, unfortunately, the one I have right now is not very good. It's not very absorbable, but this is the only one I could find currently, because literally everybody is buying zinc right now because of the COVID crisis. But I have zinc gluconate, which is not as very absorbable. The ones that are very absorbable are zinc picolinate and zinc aspartate. But more doctors advocate for zinc picolinate. And the daily recommended amount of zinc is under 40 milligrams a day. So definitely talk to your doctor about which is the best type of dosage you should be taking. This is very important. This one is 50 milligrams. Unfortunately, it's a little high, so I cut mine into 2 pieces and take it as that. And the recommendation that my surgeon gave is 2 weeks before surgery and 2 weeks after surgery. So that's why I'll also be taking zinc. So the next 2 supplements that I'm going to cover for the remainder of this video has kind of like iffy scientific data supporting their emphasis on surgical healing and decreased swelling and bruising, and that's because these 2 ingredients are homeopathic remedies. So that means they may not work for you, and they may only have such a little minimal benefit that like you don't even you wouldn't really benefit from if you took it. However, surgeons, a lot of plastic surgeons and wound repair surgeons still emphasize that if you do have the funds, and honestly these are very affordable, if you do have the funds, take it, see how it goes, and definitely something you should talk to your surgeon about, because it's been used for generations before Western medicine began. A lot of surgeons still say, hey, there's not a lot of bad side effects, so why not give it a shot? Because I've seen some of my patients have their healing improved by a lot for taking these. So the first one I'm going to cover is Arnica. And this is Arnica montana 30x concentration. This is the standard concentration that Dr. David Garamoni uses in his practice. It's a different brand that he tells his patients to get, but it's the 30x concentration. I've seen other trans men and transmasculine non-binary people take the 30C concentration. Unfortunately, there's not a lot of evidence on what concentration you should be taking of Arnica, and even like the benefits of Arnica that is tested in research are inconclusive. However, this is the oldest drug, and like people have been taking for thousands of years for wound repair and decreased bruising after surgery or after a major trauma. So that's why, even though results of this are inconclusive, they saw that some people, like some studies say the benefits are so little, some studies say the benefits are a lot, and some studies say actually this made it worse. However, because it's been used for so long, and a lot of surgeons have asked their patients to take it, and maybe it's a placebo effect that have helped their patients, because placebo is very powerful. Regardless, if the placebo helps, it helps. So Arnica is something else that I will be taking. Definitely talk to your surgeon about this. It's very important to talk to your surgeon about Arnica. And also, how often you take it, when to take it, kind of varies between surgeons. So I'm going to go by my surgeon's recommendation of taking it the day after I have my surgery done. But some surgeons can even say start 3 days before, start a week before. Talk to your surgeon to see if Arnica is a good fit for you. And finally, the last homeopathic supplement that I am taking for top surgery is Bromelain. Now, Bromelain is an enzyme in pineapples, actually. And they did enough research to... And actually, this kind of does have a pineapple... it has a fruity smell because it's extracted from pineapples. But enough studies have been done on bromelain to show that it does decrease swelling. It decreases swelling after surgery. It's incredibly beneficial. Numerous studies have proven that it significantly decreases swelling after surgery. So bromelain is one of those homeopathic remedies that have shown clinical evidence of being beneficial because it reduces the amount of gene transcription of inflammatory mediators, the things that cause swelling in our bodies after infection and after a wound, after getting a trauma or after getting like incisions done. So bromelain is actually super beneficial. The concentration that I'm taking is 500 milligrams with 3,600 gel dissolving units. And I'm going to be taking it the day before surgery, twice a day, and 2 weeks post-op. Now that is the recommendation that I got from my surgeon. So I highly recommend that you look into bromelain. If you are low on funds and you're deciding, well, I'm gonna get the 3 proven vitamins, but should I take Arnica or bromelain? I will definitely advocate for bromelain more because it has that statistical evidence that's researched and proven to be significant. Bromelain is it. I think I paid $18 for the bromelain, and I paid about $5 for the Arnica. See, it's super affordable, so that's why doctors are like, hey, if it's been used for 1,000 years, why not give it a shot, you know? So that's why I'm taking these 2. So that's kind of it. Those are the only, like, supplements that I will be taking before surgery, and I think that will be enough. I am doing some other things before my surgery to make sure I get the best results possible, and they will be in a newer video that I post later on this week. And I am going to be making a series of videos all talking about top surgery and how to recover from top surgery in the best way possible, using statistical data, using backed evidence, and using research that's out there to make sure you get the best healing possible. If you have other trans friends that are trying to get top surgery and need adequate medical knowledge about their surgery recovery, instead of just, listening to someone who doesn't have a medical background, please refer them to my channel. I would love to share more knowledge about medicine as a trans man. Thank you guys so much for watching. Thank you guys so much for helping me reach my goal of funding my top surgery. I'll see you guys on the next one. I love you so much. This is Ben.